Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Synovial fluid. Synovial fluid is a sterile fluid and it is composed of vascularized connective tissue. It is composed of vascularized connective tissue. This synovial fluid will lack the basement membrane. Okay, then there are two types of cells are present in the synovial membrane. We have type A cells and we have type B cells are present in the synovial tissue. Okay, type B cells are the cells which produce the synovial fluid. Synovial fluid is produced by type B cells. Okay, now this synovial fluid will exhibit many features. So the synovial fluid which is present, there are some important points. Now this synovial fluid, okay, this synovial fluid will actually exhibit non-Newtonian, it exhibits non-Newtonian flow characteristics. Okay, it does not have Newtonian properties, it has non-Newtonian properties. In this synovial fluid, the lubricant is not constant, and fluid in synovial fluid is not linearly viscous. It does not have same viscosity throughout the synovial cavity. Okay, then the synovial fluid has the viscosity of synovial fluid decreases and the fluid will thin down if there is continuous stress. If there is continuous stress for a over a period of continuous stress, or whenever you expose the patient to the continuous stress, in such cases the synovial fluid decreases and the fluid thins out. So what does this synovial fluid it is made up of? So what is the composition of the synovial fluid? The composition of the synovial fluid is, it is made up of hyaluronic acid, it is made up of hyaluronan or lubricant. Then proteases are present in the synovial fluid. Proteinases are present in the synovial fluid, with collagenases are the composition of synovial fluid. Among all this, hyaluronan is very important, this hyaluronan. So let us learn some important points about hyaluronan. This hyaluronan is actually synthesized by the synovial fluid. It is synthesized by the synovial membrane. Okay, and it is secreted into the joint cavity, and this will increase the viscosity, and it will also increase the elasticity of the articular cartilages. Because this hyaluronic acid is a glycosaminoglycan, it can absorb water, and thus it will lubricate the surface of the it will lubricate the surface which is present between the synovium and the cartilage. The surface between the synovium and cartilage is lubricated by the hyaluronan so that the friction between them will decrease. Then second important is this lubricant. Okay, this lubricant is also important. So this lubricant, what will secrete this lubricant? Lubricant is actually secreted by the synovial cells, and this lubricant is actually responsible for boundary layer lubrication. This boundary layer lubrication will reduce the friction between the opposing surfaces. It will reduce the friction between the opposing surfaces of the cartilage. So this is about lubricant. Then what are the functions of synovial fluid? So if you see the functions of synovial fluid, in the functions of synovial fluid, the synovial fluid will reduce the friction by lubricating the joint. It reduces the friction by lubricating the joint. It will absorb the shock, and it will also supply oxygen, and it will supply the nutrients to the cartilage, and it will supply the nutrients to the cartilage, and it will also remove the carbon dioxide, and waste materials are also removed from the chondrocytes within the articular cartilage. In the articular cartilage, it will also remove the carbon dioxide and waste materials from the chondrocytes within the articular cartilage. Okay, synovial fluid also contains the phagocytic cells, and it contains phagocytic cells which will remove the microbes and the debris. It will remove the microbes and debris, thus results in normal wear and tear of the joints, thus resulting in normal wear and tear in the joint. The synovial fluid contains phagocytic cells which removes the microbes and debris, and it will also cause normal wear and tear in the joint.
Thank you and thank you for watching.